Hello, everyone, and welcome to Gulf Coast South AHEC's Career Chat. I'm Joan Dixon, the Director of Student Programs, and I love bringing this program to you. Career Chat is a wonderful way for you to explore all the different health professions that are available to you. Because please remember, there are over 300 different health careers to choose from. So if you're thinking, I think I could have a health career, that's wonderful, but you've got a little bit of research to do to narrow down your focus. I'm very pleased to have with me today on our chat, Dr. Crystal Coyne. Dr. Coyne, please wave and say hello to all of the students.
Hi, thank you.
Dr. Crystal Coyne holds a Doctor of Pharmacy degree and is currently working as a pharmacy manager with Walgreens. She is also a tobacco treatment specialist and facilitates quit classes for Gulf Coast South AHEC. Utilizing her education and passion, she co-founded and chairs the Prescription Drug Advisory and Action Council through Drug Free Charlotte County. Dr. Coyne serves on the Professional Affairs Council of the Florida Pharmacy Association and is a member of the American Pharmacist Association. Wow. So you've been busy over your career lifetime here.
I'm very proud and passionate of my career in pharmacy, definitely.
And I'm sure that will come through as we're going through this interview process and talking with the students so they can learn more about what exactly it means to be a pharmacist. And it's more than they think. So we're going to start out with this video, give a slight interview to the students about pharmacists. And Dr. Coyne, I'm going to look to you when I share it for the thumbs up to make sure that you can actually hear it, because, you know, sometimes things happen here.
Technology always works 100%.
Sure it does. All right, I'm going to share the sound. I am going to bring up the video. And here we go.
We're pharmacists who are passionate about making your health a top priority, because we're people who care about people. It means really getting to know you and mapping out the best solutions for your health. It's being accessible whenever you need us, wherever is most convenient. It's working with the other healthcare professionals who know you best to provide you with a top healthcare plan. It's using a vast knowledge base to give you advice on health issues extending far beyond medications, like detecting dangerous symptoms and suggesting timely interventions. We're here to help you live your healthiest life. We're your pharmacist. So
that's just a brief overview, and we're getting ready to get into the nitty-gritty of exactly everything that a pharmacist can do. In fact, a pharmacist does a whole lot of things. So I'm going to share the screen and I'm going to bring up some bullet points here so we can get a good idea. Pharmacists advise doctors on what dose is safest of a medication. They figure out what medications enter your brain and other organs. They identify medication side effects, change medications based on lab values, teach patients how to use their medications, and catch drug interactions. And I'm sure that the students may not understand that everything is going on behind that pharmacy counter right there. It's not just you bring up the paper prescription and you wait for them to count out some pills and put it in a bottle and slap a label on it and call it good. There is a whole lot going on in the background. Did I miss anything, Dr. Coyne?
Well, that is a nice generalized list. And of course, we'll talk a little bit about some of the little things that happen in between all of that. But you did a great job covering the basics of the job description and many things that people don't realize, especially in a community setting. They don't realize that the pharmacist is still checking and evaluating for safe dosages, looking for those interactions for patients. And often, I don't think a shift has ever passed actually in my 20 years in the pharmacy that I haven't called a physician because there's an interaction in one of their patients' medications.
And you have to be very careful because unfortunately, the worst could happen if there was an interaction. And
actually, Joan, I'm sorry to interrupt.
No, go ahead.
One of the most interesting things I learned in pharmacy school, which says a lot because it's a long education and you learn a lot of amazing things about the body. But one of the things that really hit home was a pharmacist that's accurate 99.9% of the time in their average career span will still be partly responsible for 8 people's deaths due to interactions or adverse drug events. So
Ooh.
even the most knowledgeable and most careful pharmacist still has those, outliers that will occur over a lifespan. So it carries heavy on you, something that you really have to know and be aware of and make sure that you're being detailed.
I can't imagine. That's a staggering statistic to come up with, and something, all health professionals should be very mindful and careful because we are dealing literally with people's lives. So we have to check and double check everything that's going on. And, of course, working behind the counter there, you are essentially frontline customer service. So I'm going to bring up a little meme that you gave to me here, a little funny that we can show here with Austin Powers. So I see you took a job in retail. I too like to live dangerously. Customer service. Sometimes people aren't always happy when they're coming in there to pick up their prescriptions.
Often not. You have to keep in mind, people don't know how it works back there. They don't understand insurance and they often don't feel well. So they're coming from a long wait in the hospital or at the doctor's office, and they just want to come in, pick it up and go. Like we were talking about with details, I don't treat people's health like it's fast food, and I wish they didn't either. So it is kind of a dangerous world. I think anything in retail or community customer service, you have to deal with the dangerous as well as the people that are grateful.
I have another funny meme to bring up here. What it's like, anybody who's working in customer service, but especially if you're putting in that full day, what it's like when you're bright and sunshiny, fresh in the morning at 8 a.m. and then by 4 p.m. the world has changed after a full day being on the front lines, for sure. How do you deal with it every day, Dr. Coyne? How do you deal with it? How do you keep yourself sane?
Actually, we do breathing exercises in my pharmacy. I'm very big with team building and keeping everybody fresh. So sometimes it's important to make sure we're taking breaks, even when we're that busy. The pandemic has kind of changed things. So luckily, we have to clean more often. So the cleaning, when you spray the cleaning supplies, it has to sit for 3 minutes before you can wipe it up to really safely get all the germs and kill the bacteria and virus. So we use that time to sit in the back and do some deep breathing. And that kind of refreshes us. And it's that one person that comes in that says, thank you so much for being here, that makes the last 10 not matter anymore, that we're rude.
I understand. And that's great advice as well. And something that we could just apply to our daily lives all together is taking time to breathe, meditate, be mindful, just kind of reset yourself and go.
Every job is stressful. Everything has stressors. It's how we learn to handle it rather than react. And that's definitely true when you're right in front of people, back to back to back. There's not much time between one person to the next to collect yourself. So you have to make that time.
That is correct. 100% correct. And now some students may just think, well, pharmacists all work behind that counter at Walgreens or Publix or the medicine shop. But in fact, in pharmacy, there are so many different specialties that are available. I'm going to share the screen to show some of the specialties. Psychiatric pharmacist, transplant pharmacist, disaster response, pharmacogenomics. Well, I'm going to have you explain that one in a minute. Pediatric, oncology, infectious disease, drug information, cardiology, inventory specialist, disease management, geriatric, emergency medicine, toxicology, and I'm sure I've left out quite a few
It's growing every day. We're finding more and more untraditional roles that pharmacists can fulfill as medication specialists, and we're becoming more engaged with the healthcare team. So, especially in hospitals and teaching hospitals, clinical settings are really partnering up with the other healthcare providers for overall care. Now, you talked about the pharmacogenomics. That's one of my favorite words, by the way. That's actually relating to genetic research. We're at the very tip of the iceberg in that realm right now still. But your genetics play a large role in what medications may or may not process through your body. So we know that some things like blood thinners, we can look for certain types of genetic coding to know that this will actually work too well and be dangerous at a normal dose. We can do the same thing with blood pressure medications and even cholesterol now. So we're just on the tip of the iceberg, but it's really amazing to know that through some simple tests, we can start to find out which medications will work better for you without having to go through trial and error. And we're really looking at that with the psychiatric drugs as well.
And that's fascinating, especially if a student is thinking, well, I like human genetics, I like studying about DNA, but I also kind of like the pharmacy aspect. And they had no idea that you can actually put those two interests together. And so it's wonderful to have this information and to hear you speak on it so students can do some more research. Mm-hmm. Now, tell me, how does this work when you're in school? And we're going to talk more about that. You're going through pharmacy school. How do you decide when do you get to decide the specialties?
I think like any time you're in college, you think you're going to go for one thing and then you might find something completely fascinating. The neat thing with pharmacy is that you're still within pharmacy, so you don't have to start over. When you are towards the end of your schooling on the doctorate degree, you get a chance to do clinicals, rotations. So I do advise all students to take the rotations that are outside their comfort zone, outside of what they know. And that way you really get to experience some different things. So I had already been working at Walgreens for many years before I went to pharmacy school. So I personally had a passion for the community setting, but all my rotations were totally outside of that. I did oncology, I did infectious disease. I think that's one that we had mentioned on there as well. That was so interesting. So as you gather these different experiences and take the classes in school, you kind of see what lights you up, really, where it's like, ooh, like I'm interested in this and I can see the impact here. Cardiology, that would be my specialty. Currently, I really work a lot with pain management, but I thought I was going to be cardiology because that's the scariest thing in pharmacy because it doesn't make sense. None of the drugs are actually supposed to be used together. So it's kind of this art mixed with science. And I thought that was really neat and to be able to be a part of that. But again, life kind of plays out and you find passion in places that you're put in front of. So I ended up personally finding that even though I thought I was on this path, pain management really was my calling and a place that I could impact and stay within the community. And you don't have to make that decision when you first start pharmacy school. You just kind of go through and take as many opportunities as you can so you can discover what you really enjoy. And then even well into your career, something might change or come up. Pharmacy is changing so much. Again, the pharmacogenomics. We have a pharmacist who was actually invited to the White House to talk about pharmacogenomics. This is a new thing, and new in pharmacy means we've been talking about it for 20 years, but it's just now really gaining ground. So, I mean, who would have thought a pharmacist who opened up a pharmacy and became interested in pharmacogenomics would be sitting at the White House and talking to people about how it impacts health?
Absolutely. And it's important. I like what you said. You kind of got to keep your options open because rarely is life just a set path, point A to point B. You do not divert off of that path. You got to keep yourself open because new opportunities come up all the time. We never know, especially 18 years old, getting out of high school. Oh, I've got my life figured out. No, we usually don't. Life happens and we make a lot of different choices and things change. So thank you for that advice. Now, you don't just work by yourself there in the pharmacy. What fellow health professionals do you work with in your career?
I don't work by myself, but I do. So you're right. Absolutely. one pharmacist, unfortunately, the time of having more than one at the same time is kind of past in the career currently. So most of my healthcare professional interactions are with my technicians, which are my team and the rock of the pharmacy. I cannot have a pharmacist without technicians. I highly encourage everybody, it's even the minute bit interested in pharmacy, to become a technician first and really learn about that. But I work with them in my community setting. I do not get a lot of face-to-face time with other healthcare professionals. So I rely a lot on our daily interactions on the phone. I often talk to other pharmacists at competing pharmacies, and we've become close friends. We know each other, we ask how the kids are doing. But if we're having maybe a problem with a clinical issue or drug interaction we're not sure about, we know we can reach out to the other pharmacist, even though they might work at the giant across the street that you're not supposed to be friends with. I also have built relationships with the receptionists, nurses, PAs, and even some physicians just from the regular interactions over the phone when I'm contacting them to make sure that we're taking care of their patient and building that trusting relationship, which is difficult because when you're calling somebody to say, hey, did you really mean to write this dosage? That's not normal. It's very easy for them to be taken aback and, what do you know? This is my patient. So you do have to work to be very friendly and be mindful that they are a professional. You don't have the full information. So I always start with that. I call and I let them know that, I don't have the file, but this is what I'm seeing. Can we work on this? And that's really developed a reputation. I even have physicians that call me to ask questions because I'm always friendly with them. So even though it's not a one-on-one face-to-face interaction, very proud that I'm able to build that relationship over the phone.
Absolutely. Always be friendly and be a great communicator to wonderful pluses within a pharmacy career. And I'm glad you brought up pharmacy tech. Some students may not be aware that you can achieve a certification as a pharmacy tech at their local technical college. Usually it's a 1-year program. Now, some schools may allow you to do dual enrollment with pharmacy tech. I know Manatee Technical College in Manatee County is working towards that, being able to go into the high schools and at least get the students started in a pharmacy tech certification program. But keep your options open. Sometimes they'll have evening classes, sometimes weekend classes. So you can be taking those on the side, and it is great on-the-job training. It will get you a job in pharmacy right after that because you've got on-the-job training, you've got your certification. They don't have to start from scratch with you.
Yeah. Joan, many of the chain pharmacies will train technicians. So you don't necessarily have to have the class. You have to be at least 17 to come into a pharmacy in the state of Florida. But as you mentioned, it's the hiring process because it is time consuming to train somebody on the spot. And it's also frustrating for them because they're trying to learn while they're doing everything. And we really do see a huge difference in knowledge for the students that are coming out of the technician schools. They have a better understanding of brands and generics and drug classes, whereas somebody that's just coming in trying to learn that while they're learning a computer system and everything else is very difficult. But absolutely start seeing if it's something you're interested in. Because when you're starting as a tech, again, there's hospital, there's community. It's not just one thing for them either. And it's a great place to start to see if it's something you enjoy, see what kind of specialties you like before you spend a lot of money and time in pharmacy school.
Absolutely. Now, when we talk about clients, sometimes medications are for adults, sometimes they're for kids. In your area of expertise, what kind of clients do you mostly work with?
In my specific area, we are more of a geriatric population. Sometimes you see people come in with multiple chronic disease states. Sometimes they just want to know the best bandage to use for a cut that they have. I answer that question a lot. We talk a lot about constipation. I'm pretty much like the expert in the area there too, probably, which whoever would have thought, right? But so I have a lot of pain management, obesity, high cholesterol, hypertension, which is high blood pressure, and diabetes. I think those are probably the most common disease states almost anywhere. But that's what I get to deal with mostly on a day-to-day to help those patients manage chronic diseases over time. So they are kind of the in for the long haul patients. And of course, being a tobacco treatment specialist, I facilitate classes, and luckily my corporate area lets me partner. So I can even bring in my patients that I'm trying to help, lower their cholesterol, lower their risk for strokes and heart disease. And I can bring them in and enhance our relationship by helping them to quit smoking too.
Absolutely. So it's not only, working with them and their physician about their prescriptions, but it's also with the quit classes. And okay, now that you're seeing some troubles with your health, let's see about getting you quit.
Mm-hmm.
What about before that, prevention? What kind of work do you do with the prevention aspect?
So mostly as far as prevention, people that are coming in looking for answers on things that are prevention, usually they want to know about things like Alzheimer's or dementia. There's a lot of over-the-counter products coming out right now. So a lot of the preventative measures are actually questions about what's available over the counter, whether they should spend their money on this. So it's important to know how to read studies and understand studies and how drug approval works. Other than that, I think that people come in and they're trying to avoid injections for diabetes. So they're looking for ways that they can help lose weight, so that they can become a little more active, anything but give themselves a shot every day. So I get to help with prevention of people that are borderline or might not be getting down to the right place, because often your doctor doesn't have a whole lot of time to sit with you. Those visits are usually pretty quick, and the pharmacist is very accessible. So the range of questions that I have to be prepared to answer sometimes are amazing to me. Like I said, everything from a bandage to the most complicated series of things. And it's actually fun and exciting because no day is the same. We talk a lot about poisoning during flu season, especially with COVID, because people are watching these things online. Google is the expert. So they come in and they know what they want and they know what they believe. So when you're trying to talk with them about, no, we don't want to take half the bottle of zinc, we just take the one tablet it recommends. Sometimes they'll push back with you on that and you wonder why they came to you in the first place. But you just, give them that knowledge and the research and the background and what can happen. And it is satisfying when you see somebody go, okay, that makes sense. Let me put back 5 of these 6 bottles that I don't actually need. The internet is great, but it's not always reliable for information.
That is correct. And even though you spend many years in school, you're never done learning, are you? You've got to keep up with all the new drugs that come out, all of the misinformation that's out there, and be prepared for any question that comes your way.
Absolutely. And luckily we do have to keep up, with continuing education, but being involved in Florida Pharmacy Association and the national associations really help because they're on top of the current trends, anything that's new and updated. Because especially diabetes, it changes so much. And there's all these advancements that are occurring in different types of medications. And it's like, wait, I didn't learn that in school. I've been out of school about 8 years now. Most of what I know from graduation is actually irrelevant by now. So I'm only as good as I keep up with.
Absolutely. And you had mentioned typical day. Is there such thing as a typical day? What does your day look like?
My day varies. It's kind of the same, but it varies. Right now we're in the midst of this pandemic still. So everything's changing. There's always meetings going on with what new thing we're going to be doing or working through. So I usually start my day by reviewing any important communications. I set up goals. I'm a very task and goal-oriented person, and I like to let my team know what's expected. And I find that I'm more successful if I know what our 3 main goals are for each day. So I set that up. We update inventory. I approve the lab orders for our COVID testing. I start prepping immunizations. I start going through and reviewing data entry that the technicians have entered on prescriptions. I have to try to keep up with all the filling in the morning because there's not enough staff always. So I'm doing the actual fill process. And yes, it is true. Pharmacists do count by 5s very well. It's a funny little Seinfeld thing, but it's true. I have to communicate to store leadership to let them know what our day looks like, what kind of help I might need. I have to handle any issues I have left over from the night before, maybe missing information on prescriptions or dosages that don't look correct. So following up with the doctors, doing product review, meaning that after a prescription's filled, a pharmacist then has to review it to make sure it's the right drug in the right bottle. It makes sense all again. So that's kind of like that double checking. Call patients on the phone that have medications that might have been new. So maybe a patient that's just now starting an antidepressant, they've been on it about a week. So I will call them to see how they're doing, how they're feeling, if there's any side effects, help them with those kind of questions. We also do MedSync, which is where all the medications are filled together at the same time. So I do those work orders, make sure those are all working out correctly for the patients. More data review, more filling, more product review. And don't forget, I haven't said answer the phone a million times by now. So I'm also taking phone calls in, more vaccine preparation, transferring medications from one pharmacy to another, looking at drug utilization. And those are things that come up that say, hey, there might be an interaction with a health condition, might be an interaction with an allergy. So I have to evaluate those to see which ones are important to talk to the patient about, which ones I can't process anymore until I talk to the doctor. I also do a lot of documenting for pain management. So I have to review pain management files and go through that. Consultations that are coming up, make sure that the technicians are in workflow where they should be, making sure the patients are being taken care of, meetings that I have, and of course, handling customer concerns because I'm the manager. So I'm the one that if somebody calls with an issue or complaint, has to make sure I call them back before they get any more upset. So this is just kind of my day-to-day, everything that I have to make sure I'm doing. In addition, the most challenging part right now is the lack of staffing. Due to COVID, I think most places are understaffed, and it is a higher stress environment than it was 2 years ago. So it's been a little difficult.
That is actually a great segue. Bring up a little funny here about what your day is like. So I called the pharmacy 6 times. My prescription is still not ready. Well, maybe if you stopped calling them, they'd have time to fill your prescription.
Yes, that's the great thing about our youth, especially. We're going more digital. So as people are more comfortable using the digital platforms, you actually don't have to call. So my location has been #1 in digital the last few months, and it's really exciting because we're a geriatric area. So I've been teaching people that are between 60 and 80 how to use the app when they want nothing to do with it. So it's been exciting to see what people are actually able to learn when you kind of keep pushing and when nobody's answering the phone. So I'm really excited about our younger generations coming in because they generally know how to do this already. So I can show them exactly what to do and they've got it and they have all that information, their entire medication file and history at their fingertips. So they can always have access to it. And I think that's kind of a neat change that's been occurring in the field as well.
And I can speak to that because I remember the first time I thought, well, my medication's not ready. And they said, well, you can get on the app and then we'll send you a text when it is ready. And I was like, oh my goodness, what is this magical thing that we're doing now?
So who checks their voicemail?
It makes life so much easier because you're right. If you try and call, you all are well, first of all, the store is busy. You are busy. There's customers coming in and going out, and you just list out all the things that you're doing. There's not enough hours in the day to do what you do. So patience, I think, is the moral to that story. Be patient because what you're doing is actually very important. And I am going to bring up another funny here. Something that, and I know I can be accused of this in the past, and I'm definitely going to look at pharmacists differently now when I go in, because who hasn't thought, well, geez, how long does it take to stick a label on the box, count out some pills and just give it across to me, I'll sign off on it and we'll be done. But in reality, well, yeah, it only takes a few seconds to do that label, but it's the making sure this medicine isn't going to kill you thing that takes a little bit longer. So thank you for explaining everything that goes into being a pharmacist. It's important that we all know this.
It is. And it sounds exhausting, but it it's very exciting. And so I've been in pharmacy for 20 years as of February. So almost very close to my 20-year anniversary. And I wouldn't do anything else. I've seen it change. Right now is a little bit different than it's ever been, but with anything, change occurs, and that will happen and it becomes the new normal. And there's a lot of things that are always going on. So I always have stimulus. It's kind of like a stimulus overload sometimes, because I have to listen to what the technicians are saying to everybody while I'm doing what I'm doing. But it's satisfying to be able to look at the end of the day and be productive, know that you knocked out everything you're supposed to knock out and you took care of those patients. It's those patients that come in and just wave at you because they're, walking by shopping, and they want to make sure they said hi to their pharmacist. And, even the ones that call and will only talk to you for every little thing, or wait for you to be there to give them their flu shot. It's those trusting relationships that you're building with your community members that make trying to do all of that worth every moment.
Now, for students who are listening, they're thinking, all right, I think maybe I could do this pharmacy thing. It's sounding interesting. Tell them, how do you get from high school to having a career as a pharmacist? How did you fall into it? What path did you take? How many years do you have to go to school? Let them know the skinny on how to get from here to there.
Well, for me, I chose it because I had a conversation with my father when I was 12. So I was one of the few people that actually, yes, I know what I want to do, and didn't take a quick, easy path, but I knew the end goal there. So I knew it was something I wanted to do because I wanted to make a difference in my community. My dad really pointed out the fact that it was a stable job, which is really important for their generation. That was something you really looked for. And, it was kind of hard to be fired as a pharmacist unless you did something illegal, because you see these people go in young and they retire from the same place. So it's a very stable career. And then the aptitude tests that I took in high school, even though I wanted to be a fashion designer in the back of my mind, the aptitude test actually said career in pharmacy would be perfect. So that kind of nailed it, where it's like, oh, well, maybe that's what I'll do. And I worked at Publix as a cashier when I was in high school, and they needed help in the pharmacy and they knew I had interest. So I got 2 days to work as a cashier in the pharmacy. And there was a elderly woman that had come in, and these are the pharmacies that are a little older that were up higher. So the pharmacist had to step down to the ground to get to them, but I could see her out there, and the pharmacist from way behind the counter in glass saw her and came down, asked her by name, "How is your husband doing?" And you could just see it in her eyes. It was this sadness mixed with relief. Her husband wasn't well. He was in the hospital and he was not likely to recover. But you could just see the relief that she had from him making that connection. The pharmacist was probably the only person she talked to all day to be able to express her feelings. And it was watching that interaction for me that made me know, this is what I want to do. This is how I want to impact my community. So from high school, I joined the Army so I could become a pharmacist, because I didn't have anybody in my family that had already been to college. So we had no background. I had nobody to help me figure out what admissions look like or how to do it. And all I knew was pharmacy school was expensive and we didn't have money. So I started in the Army. The short of that story is I ended up injured, and my records, I'm still working on that, 20 years later. So when I came back, I started one class, and we didn't have internet that you could do classes on back then. I'm really aging myself there. We had cable. So local cable TV would play my English course, but I didn't have cable either because I was young and you couldn't afford that. So I would have to drive to the school after I worked full time, go to the library and rent this video from the library and watch my class. That lasted about 3 times. And after that, it was just too much for me. I didn't do it. Nobody was there to guide me about how to withdraw. So I ended up flunking because I never even knew I had to withdraw from the class. So the following semester, I enrolled to actually go to school and be there in person, which was great. I passed with an A. And then the next semester, I was pregnant. So at this point, I was just paying out of pocket for my classes. And I was trying to figure out how to do this whole thing. And I was starting to get the hang of, okay, this is how college works. This is how you apply, how you pick your classes. And I went to the financial aid office for the first time, and I was just starting to show. So she had me go ahead and change my application to child, which opened up the Pell Grant for me. So I was fortunate to go through my undergrad, most of it without having to, take out any loans. But because pharmacy does require so many prereqs, in fact, I had more than enough credits. I had over a bachelor's degree when I was done. So I had to pay out of pocket my last semester because there was not another degree I could get from that school. So in high school, I think, kind of backtracking, biology, chemistry, math, those are your cornerstone classes. I was an A student. I did very well, but I will say chemistry was not my strong suit, which is funny because that's most of the classes I did really well in my post-grad program. So don't necessarily take your, junior high and high school grades and say, oh, I can never have a career here because this isn't my forte. Because when you're looking at junior high and high school, it's kind of that standard general basic education. Sometimes you have to layer the learning. So when you take it again in college, it clicks. You're like, oh, okay, now I get it. Now that I'm hearing it again and doing it. And then you take it again in pharmacy school. So math and science, I think, is very important. Algebra, calculus, statistics, other things that you can get into. I did my undergrad at community college and a state college. So I didn't go to a big university, but I worked full time. So that allowed me to maintain living, making money while I was in school. I would suggest doing organic chemistry, anatomy and physiology, and any leadership classes you can take. Most people don't realize, again, I'm the only pharmacist there. So whether I was the manager or not, I'm the leader. I have to know how to communicate with my team, how to organize them, how to keep them getting along, and also how to have tough conversations with both patients and physicians. So taking communications and leadership would be important. So you can either do a general 2-year degree or 4-year, it depends on the school you plan on going to. And some pharmacy schools even now have extended programs where you can do your undergrad right there with them and just go right in through the whole way. You do have to have your doctorate now. So again, there's a couple different ways that you can go about doing all of that, whether you go to school part-time until you're done with your undergrad, knock it out right away, do it all at once. The important thing is researching the schools you're looking at going to, because they all require slightly different courses. So once you get there, you have to pass that program. And then if you want to work as a registered pharmacist, which, as you mentioned, like toxicology earlier on specialties. So not every role actually requires you to be a registered pharmacist. They might require the degree, but they're two separate things. So you have your degree as a pharmacist, and then you become state registered. And that requires a very tough, rigorous exam and also a state law exam. So once you're done with those, then you can practice as a dispensing pharmacist, which is traditional. But more and more, like I said, we're seeing untraditional roles for pharmacists, which is really neat.
Thank you for explaining all of the nuances on how your path to get from high school, and then, whether it be a 2-year or a 4-year degree, you have to have that base, you have to have all those prerequisites, and then you have to start in with the pharmacy school and that, and they're all going to be a little bit different. So research, and thank you for sharing your personal story. I love hearing personal stories from all of the chat interviews that we do, because it's wonderful to see how you decided on that career path, because we don't know until we know, and we take our path and we make our decisions, and you learn what you're good at, what you enjoy. Now, of course, there's the money aspect, because kids always want to know about the money. Can you tell them a salary range from starting out to the height of your salary?
Okay. So interestingly, salary for a pharmacist has changed dramatically over the years. When I first decided I wanted to be a pharmacist, again, I was 12, the salary actually had doubled by the time I was graduating high school. So this is where we started to see, the doctorates program becoming more popular, more roles for pharmacists, and there was a shortage. There weren't many. So the income you could make shot up, which is exciting. I mean, I already knew it's what I wanted to do, but making more money is always exciting. But so did the cost of school. So the income had gone up. And right now, what we're seeing is so many pharmacy schools had opened that the salary range is kind of dribbling back down a little bit. So it's kind of in that ebb. But right now, with being a shortage in almost anything, they're offering sign-on bonuses, anything they can do to get pharmacists back. So I expect that income range to go back. So for something like community pharmacy, I believe you would be able to expect anywhere from 80 to 130,000 a year, depending on your geographic location.
All right, it's good to understand everything that goes into a salary, because starting out, you're not going to make the height of the salary cap. You've got to get in there, you've got to get some on-the-job experience, you've got to get more training, and the longer you're in it, the more knowledge you gain, then your salary goes up. And it's different what city you're in, what state you're in, what specialty you have.
If you're able to move where there's a shortage and where they need people, they will pay you more. If you're living in a busy city, you might not. And starting out in the different areas of range, you can also, when you're done with school and have graduated, do a residency, which is a specialty similar to what a doctor does. So you can spend 1 or 2 years specializing even in community pharmacy as a resident. And 1 year residency is equivalent to 6 years experience. So as you can imagine, businesses want to hire people with a residency because they have an extensive knowledge and have already put it in practice. And they're very research minded in that sense. So very clinical. So when you get somebody who's done a residency, you want to snatch them up. So it does increase your chances of being hired as well. I did not do that. I was already 30 by the time I graduated. I did my prereqs part-time with a little one. So for me, I was comfortable in my setting. I knew I had a career at Walgreens. I had been there a long time. I had invested in retirement. So I just wanted to get started. I didn't want to spend another year or two kind of waiting to have my role. So I chose not to, but I do highly advocate, for the education that's available.
Absolutely. And your education can never be taken away from you. It is never a bad thing to get more education. It will go with you wherever you go. Now, as we're finishing up our chat interview today, I think it has been very obvious for the students to see that even though your job is very challenging, you truly enjoy what you do. And I want the students to know that Dr. Coyne, she shared all of these funny memes with me to make sure that you could see them. And I'm going to show the last one here that she shared. That even though, actually, Dr. Coyne, I'm going to have you read this one.
Okay. So even though I want to rip out my hair, I couldn't be happier with my career choice. And that is very true. I work in the community setting and I work out in the community using my education. So that I think is what keeps me very satisfied as well, is that I'm not just clocking in, clocking out. So I actually live out my passion for pharmacy, and I find ways that I can get involved and help the community, and just try not to pull my hair out, because it is thinning a little bit. So I think I'm probably pulling it out somewhat, but I do highly believe that we need people in pharmacy who are able to communicate, who want to help people and can lead. And I think it's one of the things that's not talked about. We think of pharmacy and we think of math and science, but leadership is important. So if you like to teach, if you like to kind of be that person that's the chaos organizer, if you will, those are all things that kind of don't get talked about when we talk about careers in pharmacy. But if that fits the things that you like to do, you find yourself doing often, it could definitely be a great fit.
Dr. Coyne, you have shared a lot of wonderful advice and information for these students. And students, as always, if you have any questions, you can see my website behind me there, www.gsaheck.org. We have a contact form on our website, and you can write into that contact form, I'd like to get in touch with Dr. Coyne. that'll come to me, and I can help you get in touch if you have any more questions. Thank you, Dr. Coyne, for giving us your time and your expertise this morning. We sure appreciate it.
Thank you very much, Joan.